Hi friends, Peter Uzelac, the Embryo MD here. In today's video, I want to talk to you about this week's revelation by Jennifer Aniston on her struggles with conception and going through IVF. And I wanted to give you some of my kind of takeaways or insights into this news story. So as many of you know, this week Jennifer Aniston had revealed in a Allure magazine news story that she had about a decade ago, it sounds like, struggled with fertility and trying to conceive. She had several quotes in there that I want to kind of comment on. The first thing I want to say is I'm just so glad that someone like Jennifer Aniston came forward to talk about this subject because, as you know, many public figures, many celebrities that come forward and talk about medical disease, that springboards a further conversation in the general public. This happened for Angelina Jolie with her BRCA genetic mutation and her intervention on that. Some of you may have seen Val Kilmer's documentary where he's very open about his throat cancer diagnosis. And then just this past weekend, the guitarist for Duran Duran, Andy Taylor, came forward and announced that he has been struggling with advanced prostate cancer. So hopefully these kinds of stories really do help raise awareness for some of the issues in the medical community. So the first thing that I kind of took away from this article when I read it was Jennifer Aniston made some kind of comment about her health guidance, like she wished someone would have kind of told her more. And she even kind of goes into possibly, egg freezing. And so the first thing that came to mind was in the article I read that she was 53. So that means that she was roughly, I'm guessing 43-ish when she was going through fertility treatment. And just purely coincidentally, 10 years ago exactly is when the professional body that most of the fertility doctors in the US belong to, called the ASRM, actually lifted egg freezing from an experimental medical intervention to an actual viable option for women. And so that was a big deal. That was in October of 2012. Egg freezing moved from experimental to a viable option. And so I guess my first thought was, I really hope that Jennifer Aniston is not kind of beating herself up too much like she wished she would intervene, because the point was intervention such as fertility preservation, egg freezing wasn't even around for her when she was in her 30s. And then the other side of that, I would comment that I'm so glad again that she's speaking up, because it is around now. In fact, if you take that 10-year period since 2012 to 2022, there's been a lot of maturity in the egg freezing technique and process, and we've gained a lot of knowledge about it. And one can say that we are truly able to offer that as a very much a viable pathway. That was kind of takeaway number one. So takeaway number two was something that I picked up on, something to the effect of you just don't think about it. And of course, that's very true. When we're young, we just don't think about future medical conditions or health problems. But the key difference with fertility preservation, especially for females, is that it's an assured thing. It's not that something may happen, but it's something will happen at a certain age. I think where a lot of the education kind of breaks down is how early that is, relatively speaking, because we see all kinds of people in their 40s and 50s and they look great. They look like they're 10, 15 years younger. You yourself may feel great. You may feel healthy. You lead a healthy lifestyle. Metabolically, you are healthy. But underlying that, there's an ovarian aging that can be happening. The same thing holds true for men too. There's a testicular aging. It's just on a different time course, so it's a little bit more upfront for females. So the point is that even though we feel healthy, sometimes that's just not the case. It makes me think about smoking, right? So everybody knows that smoking's bad for you, and though you can still find young people out there smoking, non-young people too, but it doesn't resonate so much with young people. Why? Because it's so far off in the future. So you just don't think about that, like just so many things when you're young. Sometimes if you're to be struck up close in front of you with maybe a first-degree relative that got lung cancer, well, that's gonna resonate with you more, right? So unless that happens, it just may be something off in the distant future that you just don't pay any attention to. So someone like Jennifer Aniston coming forward and talking about it is really going to make that more tangible to a young person. Now, on the flip side, I will say there's definitely been celebrities that have come out and shared their public stories, but kind of in a unfortunate way for educating young people, because they've shown themselves childbearing or having families at a much later age than we know is really viable from a biological point of view. So in other words, if a celebrity walks out of Cedars-Sinai Hospital in Los Angeles with a baby or a pair of babies in their hands, and they're 46 or 47 years old, we know biologically speaking, almost assuredly that did not come from their own eggs. So there's also this celebrity status that can lead to misinformation. So I'm so happy that someone's coming out and sharing some quality information about, this could really kind of happen to you kind of thing, such as Jennifer Aniston did. Now, the third thing that I took away, and I think this was maybe a spin-off story from the Allure article, but it had some highlights of the story, but really kind of focused on egg freezing. So I talked a lot about egg freezing and made one of the 3 bold comments were there's no guarantee in egg freezing. And so I thought that's really great that that's being pointed out, because I think that was some of the struggle when egg freezing first came about, was this kind of misinterpretation that there's some kind of guarantee. Or on the flip side of that, people made this analogy to insurance, where it's not a completely bad analogy, but with insurance, there's always a payout usually, whereas there's not necessarily with an egg thaw if you use those in the future. But the point being is that we need to raise awareness about the options, because the point is that you can't make decisions unless you have a complete picture of information. Another aspect of this that comes to mind is a very, very strong advocate for egg freezing who actually intervened early. So this is someone that intervened around the time of 10 years ago, right? And just to give you some idea about how immature the technology was then, that person was a really strong advocate, had a website, talked about it, eventually went back and thawed her eggs, and it didn't work to give her a pregnancy. So again, the technology is very mature now, and I think the takeaway is that, of course, there's no guarantee it can provide a child for you in the future, but there is a guarantee that if one day you don't do any intervention, that you will surpass that line, which Jennifer Aniston is kind of acknowledging at this point in her life. Takeaway number 4 for me was, how would I counsel my own daughter on this kind of information? So Jennifer Aniston's going to raise awareness. We're going to all start to talk about it. And it makes me think about how I would talk to my own daughter. Now, she's not at that age yet, and maybe someday we'll talk about that. But how I would approach that conversation, I think, if I could base it on what's out there today, is I'm a little bit concerned about the false reassurance that's out there, even with young people. And what I'm particularly concerned about is some of these direct-to-consumer tests are out there. You can see them in Facebook ads or lots of social media posts talking about checking your AMH, checking your FSH, checking various blood hormones, and labeling it a fertility test. And if you're not aware of the nuances that have to do with those kinds of tests, and you're not aware of really what it means to be fertile, because we're talking about fertile potential, and there's so many things that come into that besides, just take away the sperm and take away the uterus, even just talking about the eggs and the ovaries, there's so much that comes into that you cannot decipher that from a simple blood test. So there's a fine line that's being walked out there with some direct-to-consumer testing, and I'm really concerned that this would be kind of potentially misleading information. So if I was to educate my daughter, I'd educate her about the full spectrum and the very deep level of knowledge that you need to understand your fertility potential. So if you had the question, am I able to have a baby? Am I fertile? That can't be answered from a simple blood test. Even if you go to the doctor's office and they do an ultrasound, they perform something like an antral follicle count, that is just a marker. It's not telling you about true fertility potential. In fact, the only way you really know about that, short of having a baby, is if you were to create embryos. And so I want to kind of explain to you through like a spectrum here. So if you go from an egg or a sperm, and then you go all the way to a baby, that's a bunch of steps that have to take place to be met to be able to have a fertile potential. So, and the deeper you go through that spectrum, the more you know about how high of a quality the egg or the sperm or the embryo is. And so if you just have a blood test, doesn't really tell you much. If you go through stimulation to do egg freezing, that's going to tell you more. And finally, if you know how many eggs you got from that, that'll tell you even more. So this kind of performance, kind of almost, I think about that as like a stress test. It's almost like when we do the EKG stress tests on patients. So I don't have any heart pain when I walk, but if I were to jog, I get some heart pain. It's the same thing. The deeper you go into levels of diagnostics, the more you know about fertility potential. So I don't want to go too much more into depth there, but the point is that I'm concerned about false reassurance. So it has to be an early conversation, and it has to be an in-depth conversation for us to be able to give information that will help individuals make their own correct plan for them. But without that information, they'll be able to come up with a limited knowledge-based plan for themselves. So once again, thank you to Jennifer Aniston for talking about this. I hope this really does springboard lots of conversation out there on the internet. If you did enjoy this video, please consider giving it a thumbs up, and please don't forget to subscribe to this channel, the Embryo MD.